Good morning, America. Today is Wednesday, June 3rd. I am Peter Verdi.
And I am Adam Schneider. Today on Channel 7 News, we're discussing the Ebola virus. So Peter, what is the Ebola virus?
Well, Ebola is an infectious and generally fatal disease marked by severe internal bleeding.
It's extremely dangerous and fatal. It has caused major fear on a global scale. People are hiding in their homes and wearing surgical masks of fear that it is airborne. However, NIH has assured us that it spread strictly through contact with the infected bodily fluids.
Now let's go to the NIH and American Red Cross to discuss where Ebola came from. Now first off, for our viewers, give us a background on the Ebola virus, please.
Thank you, Peter. Glad to be here. Well, you see, Ebola, otherwise known as Ebola hemorrhagic fever, first emerged when the local population began building near bat populations. The bats attacked the local population and began to spread the virus. The first outbreak occurred in 1976 in San and Zaire. This began the biggest outbreak, and there hasn't been one since that day. And today, we have a huge outbreak, and it's like what's scary about it is that it's in America today.
Now, Dr. Backlund, how is Ebola transmitted, what are its symptoms, and how can it be prevented?
Ebola is transmitted mainly through social contact. Symptoms include flu-like symptoms and internal bleeding. Lastly, to prevent contracting Ebola, contact with infected individuals should be avoided.
Now doctor, we have been hearing a lot about how doctors like you dislike the media. Why is this, considering that we allowed this crisis to be known?
Well, that's a very good question, Peter. Well, you see, us doctors don't like how the media acts as a gatekeeper and a linkage institution to the public. They only share the bad things about the virus, causing global fear and chaos. And what also they don't know is that the virus is very rare to get in the US, especially in the US, because the virus originated in West Africa. And there's only been 6 cases in the US, and they're getting treated at the moment as we speak.
For instance, here at NIH, we have had patients not show up for treatment due to fear of contracting Ebola from the current patient being treated here. In reality, we have contained the virus and are taking every precaution to prevent the virus's spread. However, media's coverage does not produce only bad effects. For instance, because the media's role as gatekeeper and a linkage institution, the public has increased want for government funding of NIH, our executive agency. The increased pressure on Congress may increase the amount of funding that Congress passes in the upcoming budget.
Thank you, Dr. Backlund and Dr. Kim. Now let's go to a reporter calling in from West Africa, Nathan York. Nathan, are you there? Nathan? Apparently we're having some technical difficulties. We have a team of monkeys behind us trying to work. Nathan? Nathan? All right, we're going to get this worked out. All right, we're back. Hello, Nathan.
Hello, Adam. This is Nathan York reporting from West Africa, and here we discovered that the U.S. has been able to send approximately $517 million in aid to West African countries to try and battle the outbreak that has taken many victims over time. We have also been able to send out more humanitarian aid workers to these sites in order to distribute the vaccines to the people who haven't gotten it yet. We have gotten news that as of now, there have been a little under 10,000 cases around the world and approximately 4,800 deaths because of it. The fear level here in West Africa has steadily gone up, as is the rate of people catching the infamous virus.
Well, Nathan, what has the UN done to combat this virus?
The UN has been very cooperative in helping out this cause by sending out OCHA, which has opened a Central Emergency Response Fund that has generated $15 million in the last few months in order to fight Ebola. The U.S. has been able to use its humanitarian policy to get other nations to help with the cause that is very vital to our health and well-being. This is Nathan York. Back to you.
Thank you, Nathan.
Thank you, Nathan. Now, remember, if you come in contact with someone from West Africa or notice any of the symptoms, please seek help immediately.
That's all for tonight. Thank you so much for watching Channel 7 News. See you tomorrow.